medical tools left inside the body after surgery, organs removed when it wasn't necessary, patients dying due to improper screening procedures. These are just some of the horror stories traced back to disgraced physician Dr. Jayant Patel, who's been linked to over 80 deaths throughout his career. Adding to his obvious incompetence, Dr. Patel's bedside manner was said to have been equally terrible. At one point, he asked a patient hospitalized for a ruptured bowel if she had been, quote, eating toothpicks. Yet somehow, Dr. Patel was able to avoid any real consequences in his career spanning over 2 decades and 3 continents. So how did this fiasco go on for so long? And what became of Dr. Patel following the media storm that ultimately took him down? Jayant Patel was born into a wealthy family on April 10, 1950 in Jamnagar, a city in the Indian state of Gujarat. He received his Bachelor of Medicine and Bachelor of Surgery from the M.P. Shah Medical College in 1973, followed by a master's degree in surgery 3 years later. Dr. Patel was certified as a resident surgeon there later that year. By 1978, he had received his international certifications, leaving India to intern at a hospital in Rochester, New York towards the end of the decade. Later, he moved to Buffalo, New York for further residency, eventually becoming chief resident surgeon at the Erie County Medical Center. Despite his status as a rising star in the medical field, it wasn't long before his professional conduct came under scrutiny. An investigation by the Oregonian revealed that Dr. Patel had been kicked out of the University of Rochester's residency program after he was accused by at least 5 patients of falsifying records to state that he had examined them ahead of surgery, when, in fact, he had not. He had also been accused of pressuring a patient to not cooperate in an investigation launched by the New York State Board for Professional Medical Conduct, and was alleged to have later harassed them for doing so. For this, Dr. Patel was ordered to pay $5,000 in fines and given a 6-month suspension, along with 3 years clinical probation. Despite his failings, he successfully sought registration with the American Board of Surgery in 1988, applying for licensing in Oregon the following year. This was in part thanks to multiple letters of recommendation he had received, including one from the chief of surgery at the Rochester Hospital. Dr. Patel transferred to Portland's Kaiser Permanente Hospital, where he remained for the next 9 years. By 1992, Dr. Patel was tasked with training the hospital's newest surgeons, developing a reputation for his willingness to take on the most difficult surgeries. For this, he was voted Distinguished Physician of the Year by his fellow doctors in 1995. Some of his colleagues noticed he had an overbearing streak in him, with one recalling, quote, he boasted a lot about his surgical abilities. He was arrogant and full of himself, but there was a charming side to the man. Despite being celebrated by his fellow doctors at Kaiser Permanente, Dr. Patel found himself at the center of several cases that went wrong. 8 of these later evolved into accusations of malpractice or wrongful death. The Oregonian learned that in one such case, a 28-year-old man was left sterile following a bowel surgery performed by Dr. Patel, and in another case, a woman developed incontinence after having a kidney removed. One elderly patient even died after Dr. Patel had cut arteries and veins during an operation. Furthermore, Dr. Patel was known for his stubborn refusal to learn how to perform cutting-edge laparoscopic surgeries which could reduce the frequency of infection. At one point, Dr. Patel had given an 18-year-old girl with a family history of colon cancer a clean bill of health after using the wrong type of screening procedure for the disease. She would die of colon cancer just 2 years later. It was evident that a pattern was emerging, with the common factor being Dr. Patel. In total, there wound up being 3 individuals in Oregon who are confirmed to have died within days of being operated on by the surgeon, and countless more left in various states of injury. Though other residents would urge Dr. Patel to take a second look at certain treatments he offered, he almost always refused. In one case, a patient had sought a second opinion after a nurse confided to her that Dr. Patel had screwed up a surgery leading to a major blood clot. She later told the media, quote, "When I saw another doctor, he said I was a walking time bomb from this. They said this could kill you if a piece of this blood clot gets loose. When I mentioned that to Dr. Patel, he screamed at me like I was a 2-year-old and told me I wasn't to talk to anybody about what happened." One medical resident named Sally Ehlers described him as, quote, sloppy, arrogant, and uncaring, while under his tutelage in the early 90s. According to Hedley Thomas's book Sick to Death, Dr. Patel was an overbearing womanizer who pursued a relationship with Dr. Ehlers despite being a married man. After refusing his advances, he became especially hostile to her, and even tried derailing her career by limiting what surgeries she could perform. Dr. Ehlers soon came to the conclusion that Dr. Patel would perform complex operations not because they were medically necessary, but to boost his own status as a legendary surgeon. In one instance, the resident stated that Dr. Patel needlessly removed a patient's colon after failing to recognize signs of Crohn's disease in the man. Dr. Ehlers told the patient to stay far away from Dr. Patel, who later became, quote, very hostile and aggressive. The reason she was reluctant to speak out against him, she said, was out of fear of retaliation. Those who did sound the alarm were usually brushed off by their superiors. By 1998, a formal complaint was sent to the Oregon Board of Medical Examiners concerning Dr. Patel's conduct. A peer review of 79 cases overseen by Dr. Patel was launched, and the board hired a special consultant to investigate the surgeon. Though Dr. Patel was kept on staff, he was restricted from operating on the liver, colon, and pancreas of patients. It was later revealed that Kaiser Permanente had not reported claims made against Dr. Patel in the 1990s to avoid investigations by their insurers, instead opting to pay out $1.8 million in two different settlements involving cases assumed by Dr. Patel. According to the Oregonian, weak enforcement of laws surrounding the reporting of medical malpractice cases were what allowed Dr. Patel to slip under the radar for so long. Had the claims been made, the Oregon Board of Medical Examiners would have likely opened an investigation into the surgeon much sooner. Instead, the board was unaware that Kaiser Permanente stopped reporting cases for close to a decade at that point. Disciplinary action was finally taken against Dr. Patel in 2000 for, quote, gross or repeated acts of negligence and unprofessional conduct. The board then moved to restrict Dr. Patel's surgical practice throughout Oregon. Around the same time, he was made to sign an agreement surrendering his New York medical license. In 2003, Dr. Patel moved to Queensland, Australia, where he'd soon resume his practice as surgical director of the regional Bundaberg Hospital. He lied on his resume, saying he left Kaiser Permanente in 2002 rather than 2001. And of course, he left out any mention of his previous disciplinary action or that he had been barred from performing certain surgeries in Oregon. He was aided by 6 flattering reference letters written by doctors he had been friendly with at Kaiser Permanente. A spokesman for Kaiser later told NBC that the letters were personal ones not sanctioned by the hospital's Human Resources Department, despite the fact that several appeared on official hospital letterhead. As it turns out, Australian authorities had not properly vetted him with the Oregon Board of Medical Examiners, and thus were either unaware or unbothered by his previous citations for misconduct. Dr. Patel's arrival came at a time of slashed budgets for Bundaberg Base, when recruiting skilled physicians to the facility was difficult. Leading the hospital was Queensland Health District Manager Peter Leck, who was said to have fostered a culture of prioritizing finances over lives saved. The Sydney Morning Herald reported that Dr. Patel would often remind his colleagues at Bundaberg that they were lucky to have him, and frequently mocked the facilities as, quote, third world. Nevertheless, Peter and other hospital administrators were pleased at Dr. Patel's self-professed skill at performing any kind of surgery. To them, it seemed like Dr. Patel's $200,000 a year salary was a bargain for a man of his talent. Dr. Patel quickly went to work buttering up the hospital's management staff, lavishing them with expensive gifts like perfumes to win them over. He was not as warmly received by his own staff, however, who found him rude and questioned his competence. Nurses recount Dr. Patel being way out of his depth when it came to performing complex procedures, often piercing people's organs, then falsifying patient records to cover up his failures. In particular, he was viewed with suspicion by an intensive care nurse named Toni Hoffman, whose concerns were dismissed by her superiors at Bundaberg Base. Rather than taking her seriously, they simply labeled her a racist that couldn't handle Dr. Patel's strong personality. Yet even patients found his bedside manner awful, with one complaining of pain following treatment told it was because of her, quote, negative attitude. Behind his back, nurses and other hospital staff began calling Dr. Patel Dr. Death or Dr. E. coli due to the frequency of which his patients wound up with infections after he operated on them. Another nurse recounted how automatic it was for Dr. Patel to disavow himself of wrongdoing in the operating room, telling 9MSN, quote, even when a patient was dying on the table, blood everywhere, he'd turn around and say to everyone in the theater, this is not the result of my surgery. Some nurses and doctors would go as far as hiding their patients from Dr. Patel out of an abundance of caution, and others would do whatever they could to keep friends and family members out of his grasp. Still, aside from Tony, few in the hospital spoke out against him, so as to protect their own careers from reprisal. He became known for giving nurses and other physicians the silent treatment for months on end when they disagreed with him. One nurse, named Petra Aslett, claimed that Dr. Patel had obtained her phone number and called her house constantly trying to pressure her into going out on a date with him. Despite her refusals, he wouldn't relent. Eventually, his superiors warned him that this wasn't acceptable, but stopped short of giving him any lasting consequences. Apparently, Dr. Patel brushed this off by joking, quote, "You can't do anything in Australia without getting into trouble." The straw that broke the camel's back came in July 2004, when a man named Des Bramich was brought in for emergency surgery after a camper fell on him and crushed his chest. Treatment would need to be swift to ensure his recovery. Dr. Patel, the attending physician, believed the man had fluid building up around his heart and began preparations to drain it. But as reported by The Independent, this did not go according to plan. A scan showed that there was no fluid around the man's heart as initially believed, but Dr. Patel ignored this and decided to go ahead with the drainage anyways. The other nurses could only watch in horror as he repeatedly pierced the man's heart with a needle over 50 times to try and reduce the non-existent fluid. Mr. Bramich succumbed to internal bleeding caused by Dr. Patel's treatment the following day. In light of this, Tony pressed for an internal audit into Dr. Patel. NBC News reported that although one was finally conducted, higher-ups refused to release their findings. Adding insult to injury, Dr. Patel was allegedly made Employee of the Month not long after. Enough was enough. Tony decided that if her superiors weren't going to take her seriously, she would have to go above them to have something done about the doctor. At first, she went to the state coroner and even the police, but didn't get far. Next, she contacted Member of Parliament Rob Messenger to implore something be done about the rogue surgeon, kicking off a 20-month investigation. At first, the arrogant Dr. Patel wasn't overly concerned, believing himself to be too indispensable to be disciplined. But when it became clear the scandal wasn't going away, he quickly shifted gears to save his own hide. Dr. Patel resigned and put in an expense claim for a $3,500 trip back to the United States on April 1, 2005. Peter Leck approved it despite knowing the accusations against Dr. Patel. Even with Dr. Patel gone, Tony Hoffman was hounded by her superiors for speaking out, who threatened to fire her or even have her arrested somehow. 2 weeks later, the Courier-Mail revealed that Dr. Patel was hiding out in his Portland mansion, and at the advice of his lawyer refused all requests for comment by their journalists. By late May, a class action lawsuit was being pursued by several of Dr. Patel's former patients, led by lawyer Ian Brown. Over 2,000 former patients of Bundaberg Base were contacted to inform them of the case against the doctor. It was noted that most of the 87 patients who died after being treated by the disgraced surgeon were already quite sick, making establishing his culpability difficult. Nevertheless, Ian Brown argued that none of them could have provided proper informed consent as they had not been made aware of Dr. Patel's falsified credentials. Several of Dr. Patel's former patients banded together and urged others to come forward with their own horror stories. One dubbed the circumstances, quote, "a health scandal unprecedented in Australia, maybe the Western world." Indeed, the public was outraged by the claims against Dr. Patel, and the lengths gone to by some of his superiors to cover up his negligence. The Courier-Mail refuted the notion that Dr. Patel had expertly hid his past from hospital administration, stating his dubious history could be found through a quick Google search. Several nurses from Bundaberg corroborated Tony Hoffman's accounts of having concerns about the physician dismissed by hospital administration, though they were not as eager to have their own names revealed out of fear for their jobs. Queensland Premier Peter Beattie drew a public inquiry that month to investigate these circumstances. And so the Bundaberg Hospital Commission of Inquiry began, led by Queen's Counsel Anthony Morris. The Sydney Morning Herald noted that the inquiry's scope went beyond just the complaints about Dr. Patel. It was an investigation into the overall state of Australia's hospitals, specifically the circumstances that enabled physicians like him to run rampant in the first place. Anthony Morris pressed Peter Leck on why he constantly covered for Dr. Patel, up to and including the approval of his expense claims filed after resigning. Peter denied any memory of doing so and passed off responsibility onto the hospital's head of medical services, Dr. Darren Keating. When Anthony point-blank asked him whether he was bothered by the fact that covering up Dr. Patel's negligence may have led to the death of patients, Peter bluntly responded, quote, "It's the role of the Director of Medical Services. I'm not a clinician." The inquiry learned that alarm bells were going off with senior medical staff as early as 2 months into Dr. Patel's tenure at Bundaberg Base. He had a reputation for not washing his hands before inspecting the wounds of his patients, once boasting, quote, "Doctors don't have germs." Dr. Patel was also said to have met with multiple patients in succession while failing to follow sanitation procedures, even removing catheters without gloves in some instances. In one case, he was said to have used the same syringe on 2 different patients without sterilizing it. After the hospital's infection control coordinator brought the issue about his hygiene to Dr. Keating, Dr. Patel allegedly tried confronting her at her home, Throughout the hearings, the committee heard more nightmarish stories about Dr. Patel, like how he amputated the leg of a diabetic woman then forgot to check in on her for 6 days, by which point she had developed gangrene. NBC reported that Dr. Patel prematurely pulled a woman off life support days before Christmas so he could use her bed and ventilator for a different surgery. Dr. Patel reportedly threw a tantrum over the nursing staff's refusal to grant this because he wanted to get the job done so he could start his holiday early. In another instance, the hospital's director of medicine saw a patient screaming in agony as Dr. Patel carried out heart surgery on him without properly administering anesthetic. Though he had raised the issue with Dr. Keating, much like Nurse Hoffman, he was given the cold shoulder and told they were running a business. Anthony Morris continued to grill Peter Leck over his lack of concern for whether Dr. Patel was even qualified for his role as the director of surgery. At one point, he told the district health manager, quote, "You're just far too busy, are you, to trouble yourself with whether or not that people being held out as surgeons at your hospital are actually qualified." All Peter responded with was that it wasn't his job to do so, once again passing the buck to Dr. Keating. By June, the case had made international headlines. Early that month, an interim report from the commission recommended charging Dr. Patel with manslaughter or even murder over the death of a man who had part of his esophagus removed in a procedure other doctors refused to do because of the elevated risk involved. Fraud charges were also in the works, owing to Dr. Patel leaving out his past disciplinary incidences on his application. Of the 13 patients who had died from poor care on Dr. Patel's part, 8 had had operations he was banned from performing in Oregon. The Morris inquiry laid much of the blame on Queensland officials, arguing that they hadn't vetted their newest surgical director well enough. Premier Beattie assured the public that the inquiry's findings would be taken with the utmost seriousness, saying Dr. Patel should have never been allowed to practice in Australia in the first place. But this wasn't the end of the story. Dr. Keating and Peter Leck moved to have the inquiry shut down, under the notion that Anthony Morris had demonstrated too much bias against them. And amazingly, this worked. Justice Martin Moynihan of the Queensland Supreme Court ruled that in his questioning of the men, Morris had been, quote, sarcastic and belittling, and that he had shown a, quote, pervasive disdain for or contempt towards bureaucrats. This effectively buried the Morris inquiry's recommendations that Dr. Patel be charged. A second inquiry, dubbed the Queensland Public Hospitals Commission of Inquiry, was launched that September. Nicknamed the Davies Commission, it proved more damning for Dr. Patel and his compadres. During the second inquiry, Dr. Keating admitted to receiving multiple complaints about the surgeon, but that they did not, quote, register on his radar. It turned out Dr. Patel had threatened legal action against Queensland Health along with several employees at Bundaberg Hospital over confidentiality leaks and what was viewed as a lack of support against Tony Hoffman's accusations. A mediation session was proposed between her and Dr. Patel over their so-called personality differences, but this fell through after Tony filed her formal complaint. The final report was published at the end of November 2005, totaling over 500 pages in length. Once again, much blame was laid at the hands of Dr. Keating and Peter Leck, with the report characterizing them as enablers who consistently downplayed concerns about their star surgeon. The culture of treating the hospital as a business was considered a major factor in their ongoing indifference, although it was acknowledged that extremely tight budgets fostered an environment where this management style could seem justified. The Davies Commission concluded that matters ought to be turned over to Queensland Police Service for further investigation. Charges of manslaughter were suggested against Dr. Patel, along with further charges of misconduct against Dr. Keating and Peter Leck. Dr. Keating departed Queensland Health in disgrace that November, with Peter Leck following suit in December. No further action was taken against the men. By February 2006, the police probe into Dr. Patel's case was finished, and they were ready to hand off their investigation to prosecutors. Their recommendation was that Dr. Patel be hit with 4 counts of manslaughter, 6 counts of causing grievous bodily harm, and a whopping 16 counts of fraud. It would be up to Queensland prosecution to decide whether or not to move forward with these charges. Throughout all this, Dr. Patel had continued laying low back in the United States, leading to options for bringing him back to face justice being reviewed. His American lawyer continued to insist upon his innocence, vowing that Dr. Patel planned to resist any attempts at extradition. Dr. Patel's Oregon medical license was stripped from him in June 2006, legally preventing him from applying for a medical license anywhere in America. The fallout of the Queensland health crisis affected local elections, with the scandal a decisive factor to voters. In November 2006, several warrants were finally issued by an Australian court for Dr. Patel's arrest, including 3 charges of manslaughter and 5 of causing grievous bodily harm. The government believed that Dr. Patel had directly contributed to 13 deaths through his sloppy treatment. If convicted, Dr. Patel was looking at the possibility of life behind bars. Queensland's premier noted that extradition proceedings could take a while and asked for the public's patience. By March 2007, Dr. Keating was cleared of any wrongdoing for his part in the Dr. Patel case, a decision which outraged the disgraced surgeon's many victims. The public believed this reflected the lack of accountability within the Queensland health system, a recurring theme throughout both the Morris and Davies inquiries. Come October, the decision against prosecuting Dr. Keating for his role in the cover-up was under review. Several members of the BD government found themselves sacked over the healthcare scandal, including Queensland's health minister and the Attorney General. FBI officials arrested Dr. Patel at his Portland home on March 11, 2008. He was given a public defender after complaining he couldn't afford a lawyer, despite living in a $1 million mansion at the time in Oregon. He had little to say during the hearing. Despite his previous attempts at infidelity, Dr. Patel's wife remained by his side during his court battle. Dr. Patel at first resisted attempts to extradite him on the basis that he had a heart condition, but this failed. He would spend the next 4 months in a maximum security cell in Portland. Dr. Patel agreed to be extradited to Australia in June 2008, intent on clearing his name. He arrived back in Australia in mid-July. One of Dr. Patel's few supporters warned that he was at risk of being harassed or even attacked in public, worrying that the media circus could lead to bullying. Though he was considered a flight risk, he was permitted to remain under house arrest while awaiting trial after posting a $20,000 bail. Dr. Patel's location was kept a secret through this time, with his living expenses taken care of by Queensland Police. Dozens of stories of Dr. Patel's incompetence were recounted throughout his 2009 pre-trial hearing, exposing international audiences to just how bad things were during his tenure at Bundaberg. Though he had little to say throughout the proceedings, he was quick to jot down notes about each and every incident. But making a case for his innocence was an uphill battle. Dr. Kees Nydam, the doctor who had hired him back in 2003, said he would have never backed Dr. Patel had he known about his troubled past in America. It was reiterated that Dr. Patel had routinely performed operations he had been restricted from back in the United States. A friend of Dr. Patel's from Texas, Dr. Vijay Mehta, told the media that the surgeon was being used as a scapegoat to take the heat off higher-up medical officials in Queensland. Dr. Mehta had previously authored a scathing opinion piece decrying those putting the blame squarely on Dr. Patel, saying that calling him a bad surgeon was, quote, easy to say but difficult to prove. He lauded Dr. Patel for being willing to take less pay to work in the underperforming Queensland healthcare system and believed that patient complaints against him were sensationalized. Dr. Mehta suggested that pursuing him in court could lead to a shortage of surgeons over a fear of they too being labeled Dr. Death. The trial of Dr. Jayant Patel went ahead in March 2010. Dr. Patel, of course, pled not guilty. By June, he was found guilty of the 3 manslaughter charges, along with a single count of causing bodily harm. For this, he would receive a 7-year jail sentence, which was decried as totally inadequate by Rob Messenger. He believed this to be but a slap on the wrist that would do nothing to restore faith in local healthcare. The judge argued that the 7-year sentence was decided upon due to the difficulty Dr. Patel's family in America would have in visitations, and that he would be a potential target in the penal system due to his notoriety. Though Dr. Patel's legal team intended to appeal, he apparently didn't have the money to do so at the time. The appeal was delayed until November when he could put together the funds. By early 2011, it was heard by the Queensland Appeals Court. His lawyers condemned the sentence as, quote, manifestly excessive. His appeal was ultimately denied in April. Dr. Patel's lawyers decided to escalate things to the High Court of Australia that May. In February 2012, it was learned that Peter Leck had obtained his credentials to practice medicine and was working as a doctor in Western Australia. Rob Messenger found this turn of events to be incredulous, lodging a complaint with the Australian Health Practitioner Regulation Agency. This was, however, unsuccessful. Dr. Leck appears to still be practicing as of January 2025. Dr. Patel's second appeal in August 2012 was successful, with the court finding that the trial had been, quote, tainted by weeks of highly emotive and prejudicial evidence that was ultimately irrelevant to the Crown's case. This boiled down to the prosecution's admittance on the 43rd day of the trial that Dr. Patel's incompetence could not be proven in the court of law. Nevertheless, Dr. Patel was made to stand a retrial over one of the manslaughter charges. The retrial went ahead at the Brisbane Supreme Court in February 2013. Though he was found not guilty, the Queensland Director of Prosecutions confirmed that all outstanding charges against Dr. Patel would be pursued. After several months, a new verdict was reached. Dr. Patel admitted to 4 counts of fraud stemming from falsifying his credentials to get the job at Bundaberg. The remaining manslaughter and fraud charges were dropped. The judge sentenced him to 2 years in prison and suspended the sentence. Dr. Patel went free that very day. The judge was quick to note, however, that the man had not shown even an ounce of remorse over what happened. With nothing left for him in Australia, Dr. Patel quickly booked a flight back to America. He considered seeking damages over the time he had served, but the idea was shot down by the Queensland government, who called it a, quote, insult to Bundaberg residents. Though he had long since left Australia, Dr. Patel's medical license was permanently revoked over there in 2015. Since returning to America, he has kept a low profile, and it's unknown what he's been up to following the conclusion of the worst medical scandal in Australian history.